A patient states their name but refuses to give date of birth. What should you do? A. Skip the DOB and continue. B. Ask a staff member to confirm identity. C. Politely explain it is required and verify with 2 identifiers. D. Use the requisition only. Answer: C. 2 identifiers are mandatory. Patient cooperation must be obtained. Which step should occur immediately before venipuncture? A. Requisition verification. B. Patient identification confirmation. C. Tube preparation. D. Labeling tubes. Answer: B. Patient identification must always be confirmed immediately before any specimen collection. If a patient speaks a different language and no interpreter is available, what is the best action? A. Proceed without confirmation. B. Use gestures and write requisition info. C. Get assistance from bilingual staff or interpreter services. D. Ask another patient for translation. Answer: C. Proper identification requires clear communication. Interpreters ensure safety and compliance. Which patient would require fasting instructions before collection? A. Blood culture. B. Fasting glucose. C. CBC. D. ESR. Answer: B. Glucose testing requires fasting for accuracy. The patient must be prepared appropriately. What is the very first step in patient identification before drawing blood? A. Asking the patient's date of birth. B. Checking the test requisition form. C. Introducing yourself and confirming patient identity. D. Verifying tube color selection. Answer: C. The first step is to introduce yourself and verify patient identity with at least 2 identifiers before proceeding. A hospitalized patient is unconscious with no ID bracelet. What should you do? A. Ask the nurse to confirm identity and proceed. B. Refuse to draw until a bracelet is applied. C. Use bed number as identification. D. Ask another patient in the room. Answer: B. Blood cannot be drawn without a valid ID bracelet. Proper identification is mandatory to ensure patient safety. When identifying a pediatric patient, which method is most accurate? A. Asking the child directly. B. Confirming with a parent/guardian and checking ID bracelet. C. Relying on the child's room number. D. Asking the physician. Answer: B. For children, both the guardian confirmation and hospital ID bracelet are essential for accuracy. Which is the correct minimum number of identifiers required for patient verification? A. 1. B. 4. C. 3. D. 2. Answer: D. At least 2 identifiers, e.g., full name and date of birth, are required by safety standards. The best way to reduce patient anxiety before a draw is: A. Avoiding eye contact. B. Explaining the procedure calmly. C. Drawing blood quickly without explanation. D. Ignoring patient concerns. Answer: B. Clear, calm explanation reassures patients and reduces anxiety. Which is not a valid identifier? A. Patient's verbal confirmation of full name. B. Date of birth. C. Room number. D. Hospital ID bracelet. Answer: C. Room numbers are not acceptable identifiers due to potential patient movement. A patient with dementia insists on a different name than on the chart. What should you do? A. Use the name they provide. B. Proceed only if family agrees. C. Skip identity check. D. Check ID bracelet and confirm with nurse. Answer D. Dementia patients may give false identifiers, always confirm with bracelet and staff. Which is correct when preparing a patient for a lipid panel? A. No preparation is needed. B. Patient must fast 8 to 12 hours. C. Patient must fast 2 hours. D. Only water must be restricted. Answer B. Lipid testing requires 8 to 12 hours of fasting for accurate results. What must always match before blood collection? A. Tube color and test ordered. B. Number of tubes and nurse's order. C. Collection site and needle size. D. Patient's identifiers and requisition form. Answer D. Patient ID and requisition must match exactly to prevent errors. Which patient requires written consent before collection? A. Routine CBC. B. Alcohol testing for legal purposes. C. Electrolyte panel. D. Glucose screening. Answer B. Legal alcohol testing requires documented consent and strict chain of custody. If a patient is fasting but accidentally drank black coffee, what should be done? A. Continue collection as normal. B. Cancel the test. C. Notify the nurse/physician before proceeding. D. Ask patient not to mention it. Answer C. Any deviation from preparation instructions must be reported to ensure test validity. How should you verify identity for an outpatient without an ID bracelet? A. Ask full name and DOB, then match to requisition. B. Use physical description. C. Call their phone number. D. Use initials only. Answer A. Outpatients must provide 2 identifiers matched to requisition before collection. When explaining fasting requirements, what should be emphasized? A. Fasting means no food, only water is allowed. B. Fasting means no water at all. C. Patient can drink juice. D. Patient can eat light snacks. Answer A. Fasting allows only plain water, food or drinks may alter results. Before drawing from a patient with IV therapy, what is correct? A. Always draw above foresight. B. Always draw from the opposite arm. C. Remove 4 first. D. Draw from 4 line directly. Answer B. Opposite arm is preferred to avoid dilution and contamination. A patient refuses phlebotomy. What is the correct action? A. Insist and continue. B. Document refusal and notify nurse. C. Leave requisition blank. D. Ask family to force patient. Answer B. Patient rights must be respected. Refusal is documented and reported. Which test requires patient preparation regarding exercise avoidance? A. Glucose tolerance test. B. CBC. C. Potassium. D. Cholesterol testing. Answer D. Exercise can falsely lower cholesterol. Preparation includes avoiding physical exertion. A patient gives correct name but incorrect DOB. Next step. A. Accept name only. B. Clarify DOB and confirm again. C. Proceed without DOB. D. Ask staff to guess. Answer B. Both identifiers must be accurate before proceeding. Which is an acceptable alternative when a patient cannot speak? A. Family confirmation with ID bracelet. B. Guessing from requisition. C. Using bed chart. D. Skipping ID. Answer A. Bracelet plus caregiver confirmation ensures proper ID. Why is pre-test patient preparation critical? A. It saves phlebotomist time. B. It ensures accuracy of results. C. It reduces supply use. D. It speeds reporting. Answer B. Patient preparation directly affects accuracy of diagnostic tests. For a urine drug screen, which is most important? A. Patient must drink water. B. Chain of custody documentation. C. Room temperature urine. D. Skipping ID bracelet. Answer B. Chain of custody is essential for legal validity. A patient's armband is illegible. Correct action? A. Guess the letters. B. Ask family to confirm. C. Proceed with requisition only. D. Verify with nurse and replace bracelet before draw. Answer D. ID must be legible, bracelet replaced before draw. If patient is fasting, when should collection be scheduled? A. Afternoon. B. Early morning. C. Any time convenient. D. Before bedtime. Answer B. Morning is preferred to ensure accurate fasting period. What should a phlebotomist do before entering patient room? A. Knock and introduce themselves. B. Enter silently. C. Start preparing tubes. D. Wait for nurse. Answer A. Professional introduction ensures patient trust and comfort. Which test requires avoiding biotin supplements before collection? A. Thyroid function tests. B. CBC. C. Glucose. D. Cholesterol. Answer A. Biotin interferes with thyroid assays. Patient must discontinue prior to collection. Why should patients be seated or lying down during venipuncture? A. To relax phlebotomist. B. To prevent injury in case of fainting. C. For faster blood flow. D. For easier vein access only. Answer B. Proper positioning prevents falls if patient faints. Which patient instruction is correct for a glucose tolerance test? A. Fast 8 to 12 hours, then remain seated during test. B. Eat normal meals before test. C. Exercise during waiting periods. D. Drink coffee for energy. Answer A. Fasting and resting are required to avoid influencing glucose results. Before performing a venipuncture, the phlebotomist notices the patient's armband is missing. What should be the next step? A. Ask the patient their name and proceed. B. Ask a coworker to confirm the patient's identity. C. Request a nurse to provide a new armband before collecting. D. Collect the sample and label it later. Answer C. No blood draw should occur without a verified patient ID band. A new one must be issued by authorized staff before proceeding. A phlebotomist greets a patient who speaks little English. How should identification be confirmed? A. Ignore and proceed if they nod yes. B. Use a hospital translator or translation card. C. Ask the patient to sign initials only. D. Confirm with another patient in the room. Answer B. Proper identification requires clear communication. A certified translator or translation tools should be used when language is a barrier. Which of the following is the safest way to identify a newborn in the NICU? A. Mother's verbal confirmation only. B. Checking the crib card. C. Comparing the baby's ID band with the requisition. D. Asking the nurse to point to the baby. Answer C. Newborn identification relies strictly on matching the ID band on the baby to the test requisition, not the crib card or caregiver only. A phlebotomist is preparing to collect a stat specimen. What is the first patient preparation step? A. Verify test order and patient ID. B. Gather all supplies. C. Apply tourniquet immediately. D. Label tubes in advance. Answer A. Patient identification and order verification always come before equipment preparation or tourniquet application. Which identification detail is most critical in avoiding specimen mix-ups? A. Patient's room number. B. Patient's middle name. C. Date of birth. D. Name of attending physician. Answer C. Full name and date of birth together provide unique identification. Room numbers and physicians can change, but DOB is permanent. In long-term care facilities, a phlebotomist should identify residents by A. Asking a staff member to point them out. B. Checking ID wristband and confirming verbally if possible. C. Collecting samples from all residents in order. D. Relying on the room chart alone. Answer B. Even in long-term care, wristbands and verbal confirmation are required whenever possible to avoid misidentification. What is the safest way to prevent pre-analytical errors during patient prep? A. Collecting as quickly as possible. B. Proper patient identification and verifying instructions. C. Asking a coworker to help hold the patient. D. Skipping confirmation if patient looks familiar. Answer B. Most pre-analytical errors occur due to poor patient identification or missing preparation instructions. A patient states they are fasting, but the phlebotomist notices a food tray nearby. What should be done? A. Ignore and collect sample. B. Cancel collection. C. Remove tray and proceed. D. Ask if they ate, document, and notify nurse/physician. Answer D. Fasting verification is crucial for tests like glucose or lipids. If fasting is doubtful, document and notify staff before proceeding. When should the phlebotomist label the specimen tube? A. Before entering the room. B. Immediately after collection, in presence of patient. C. After leaving the patient's room. D. After tubes are centrifuged. Answer B. Tubes must be labeled at bedside after collection in presence of patient to ensure accuracy. What is the most reliable identifier when two patients share the same name? A. Patient's room number. B. Patient's age. C. Patient's medical record number. D. Patient's insurance provider. Answer C. The medical record number is a unique identifier and prevents confusion in cases of similar names. Which action demonstrates correct patient preparation before venipuncture? A. Asking patient to clench and pump fist continuously. B. Ensuring patient is seated or lying safely. C. Drawing blood while patient is standing. D. Ignoring patient anxiety. Answer B. Patient should be seated or lying to prevent fainting accidents. Pumping fist continuously is not recommended. A phlebotomist enters a room and finds two patients without wristbands. What is the correct action? A. Identify by verbal confirmation only. B. Collect from whichever patient responds first. C. Request staff to issue wristbands before any collection. D. Ask family member to confirm. Answer C. Wristbands are required for identification. No collection is performed until wristbands are properly issued. When verifying a test order, which of the following must always be matched to the requisition? A. Patient's initials and diagnosis. B. Patient's ID band and DOB. C. Physician's name and test date. D. Insurance information. Answer B. The requisition must match with the patient's ID band information, including full name and DOB. A phlebotomist greets the patient, but the patient is unconscious. How should identification be verified? A. By asking the family member only. B. By checking wristband and confirming with nurse. C. By drawing without identification. D. By asking another patient in the room. Answer B. Wristband plus nurse confirmation is required when the patient cannot verbally confirm identity. Which patient instruction is most important before a glucose tolerance test? A. Patient must fast and avoid smoking before test. B. Patient must drink coffee to stay alert. C. Patient must eat large meals before test. D. Patient must avoid sleep. Answer A. Glucose tolerance requires fasting, and smoking/caffeine can interfere with results. If a phlebotomist notices that a patient's wristband information does not match the requisition, what should be done? A. Collect sample and fix later. B. Ask another phlebotomist to collect. C. Stop and request correction before collecting. D. Ignore and use verbal confirmation only. Answer C. Any discrepancy must be corrected before collection to ensure legal and diagnostic accuracy. What should a phlebotomist do if the patient refuses a blood draw? A. Persuade forcefully to get sample. B. Respect refusal, document, and inform nurse/physician. C. Collect samples secretly. D. Ask family to hold the patient. Answer B. Patients have the right to refuse. Documentation and notifying healthcare staff is required. Which is the correct two-step verification in patient identification? A. Name and room number. B. Name and physician name. C. DOB and test ordered. D. Name and DOB. Answer D. Name and DOB together are the accepted two identifiers. Room numbers or physician names are not reliable. A phlebotomist is collecting from a patient with dementia. The patient cannot confirm identity. What should be done? A. Ask another patient in room. B. Check wristband and confirm with nurse or caregiver. C. Proceed without confirmation. D. Call family on phone to confirm. Answer B. Wristband check with nurse or caregiver confirmation is required for patients unable to confirm. Which step ensures accuracy when preparing a patient for timed specimen collection, e.g., drug levels? A. Follow exact collection schedule ordered. B. Collect whenever convenient. C. Skip documentation if collected late. D. Collect with other routine labs anytime. Answer A. Timed collections must be drawn at precise times to reflect accurate drug or analyte levels.